Hello everyone, my name is Laura Mattern and I'm a Portfolio Manager at Johnson Investment Counsel, and this is JIC Research Edge. I'm joined today by Joe Abbott, who's a research analyst covering the healthcare sector for the firm. In his role, Joe's had a front row seat to watch how the sector has responded to the many challenges posed by the COVID-19 pandemic. Today, he'll address the impact that COVID has had on the sector. Joe, obviously we've had many ups and downs as COVID waves have ebbed and flowed. Where are we today in the United States?
Yeah, good question, Laura. Well, the most recent Delta variant wave that hit the U.S. starting in midsummer really has crested at this point, and in aggregate, case counts are down across the U.S. Now, the Delta wave was more pronounced in southern parts of the United States, hitting states like Florida, Louisiana, and Arkansas relatively hard. While in aggregate, case counts are on the decline in the U.S., we are still seeing pockets of pressure in the Midwest, where states like Pennsylvania and Michigan are close to peak COVID case levels. Specific for Ohio, the most recent wave seemed to have peaked in mid-September, and at this point we are well below prior peak levels. Beyond the COVID case narrative, COVID obviously impacts the financial markets as well. Monitoring COVID trends has proven to be useful not only for understanding market movements, but for identifying individual stocks as well. For example, if we see a high-quality stock that has become attractive on valuation due to COVID-related volatility, we would certainly look to take advantage of that.
In the United States, we're very fortunate to have widespread access to vaccines, and every adult that wants one has had the opportunity to get one. How long will it take vaccine makers to ramp up supply to give everyone in the world that opportunity?
You're right. The U.S., along with other wealthier or more advanced countries, have now had broad access to vaccines for several months. At the same time, more developing countries are still struggling to procure enough supply for their population. And the main issue isn't necessarily tied to overall vaccine production. In fact, if we look at global vaccine production, we're on pace to pump out about 1.5 billion doses of vaccine per month at this point. And for the year, we're on pace to produce about 12 billion vaccines. And for context, that's about enough to vaccinate 70% of the global population. The bigger issue that's hindering the global vaccination story is really how these vaccines are being allocated to countries. The trouble is that to date, many of the vaccines that have been produced have been allocated towards these advanced countries. Meanwhile, the developing countries are still struggling to procure supply. So simply put, advanced countries have a large pile of vaccines that are being unused at the expense of developing countries. For developing countries, there are also distribution and delivery bottlenecks to consider, which further exacerbate the global vaccine story. That said, to your question, while global vaccine production isn't the main bottleneck, producing more vaccines does help the story. And what we've seen from a number of global vaccine developers are expectations to increase production into next year. So not only will we have more vaccines produced in 2022, but in several instances, these developers are actually expanding their manufacturing footprint closer to developing countries, which should alleviate some of those distribution and delivery bottlenecks I mentioned.
What industries within the healthcare sector have experienced the most change due to COVID? Where have there been beneficial impacts, and what companies has it hurt?
The healthcare industry has been impacted in a few interesting ways. So on the beneficiary side, almost overnight, COVID created multi-billion-dollar markets for COVID testing and COVID vaccines. Now for the COVID vaccine story, obviously the developers themselves, such as Pfizer and Moderna, have benefited. But really that benefit has trickled down to a larger swath of companies within the healthcare system. For example, companies that provide the raw material inputs that go into vaccines, companies that provide the vaccine manufacturing equipment or know-how have also greatly benefited. The other area within healthcare that's taken a large step forward during the pandemic is the area of telehealth. What we've learned over the past 18 months is that telehealth serves as a viable alternative delivery method across a variety of healthcare specialties. Family medicine and psychiatry in particular are two areas where telehealth has gained a lot of traction. On the negative side, really a large part of the healthcare sector was negatively impacted initially. We saw in aggregate lower utilization levels across the healthcare system, meaning that fewer people were going to their doctor's visits, fewer prescriptions were being written, fewer medical procedures were being done, etc. Now that we're 18 months into the pandemic, a lot of those headwinds have subsided, and in aggregate utilization levels are pretty much back to where they were pre-COVID. That said, there are a couple of pockets that are still feeling COVID-related pressures. For example, Procedures that are more deferrable in nature, such as orthopedic surgeries or cosmetic surgeries, are still feeling COVID-related pressures.
Has COVID had an impact on patients coming in to seek treatment or getting screened for health issues?
Absolutely. Unfortunately, like I mentioned, a lot of patients last year deferred medical treatment due to COVID-related concerns. A report from the CDC out last year actually estimated that as many as 41% of American adults delayed medical treatment due to COVID-related concerns. So not only does that mean that chronic conditions went untreated for longer, but also fewer preventative measures were taken, such as cancer screening or immunizations. And while it's difficult to quantify the impact this deferral of care will have on the healthcare system moving forward, I do think it's fair to assume that we could see a wave of sicker patients in the future that could require more complex medical attention. That would ultimately lead to higher healthcare costs.
Thanks for your time today, Joe. And thanks to all of you at home for watching. As always, please reach out to your portfolio manager if you have any questions. We're more than happy to help.